Dr Teck, very good morning to you.
Good morning, Mike. I'm the handsome version.
Yes, and very good to see you. We've been talking about NHS waiting lists for a very long time here because this government continues to try and mislead the public by saying, one, we're inventing millions and millions of more appointments, which everybody knows is a crock of nonsense, because what they're doing is sending people appointments and then cancelling them and then claiming that we've made an appointment. Now it turns out, when they say that they've reduced the numbers on the waiting list, hospitals are being paid £33 for each patient they remove from a waiting list. So what's going on here?
Well, that's most egregious, isn't it? What sort of waiting list are we talking about? What conditions are being reduced off the waiting list? If we're talking about waiting for a coronary stent, we're potentially dealing with something that's life-threatening. If we're dealing with something like a knee replacement, we're actually prolonging people's misery. And, you know, to actually say to reduce that waiting list by with a £33 gift, I think is most corrupting. Now, what it is I've looked at this situation. If you have somebody who is waiting for, say, a coronary bypass operation, and you lock that person off the list by saying, we'll change your drug, we'll review the situation, that person then is placed in a risk situation where life could be threatened.
Yeah.
And if you look at something that's more benign, relatively, like a knee replacement, you're causing the patient further misery. Now, don't forget, you know, there are a lot of people whose employment depend on full mobility and good health. If you deny people that, I think it is most sinister, because not only will the person suffer, the country's economy will go down. And what's worse is we're paying taxes at very high rates, and we're not getting the service we're supposed to get.
Well, I hear from people literally every day. I mean, I haven't asked for them yet, but if I ask for stories today, I know I'll get loads more of people who have had an appointment cancelled, somebody who's been waiting 6 months to see a doctor, somebody who's been waiting 2 years to be given permission to get an operation or a procedure properly organised. You know, the whole system is in free fall. It doesn't really work. But what we're saying here is that apparently a former number 10 advisor on health to Rishi Sunak has highlighted data from the Dudley Group NHS Foundation Trust showing that it had removed more than 5,000 patients from the waiting lists. It doesn't say who they are or what they were waiting for, but that creates £165,000 worth of income for the health trust.
Exactly. Isn't it corrupting? Because if you were a waiting list patient, you will be screaming like mad at them.
Yeah.
I think this is very, very disconcerting, because we are not getting the service we want. There's nothing to be proud about. We are making what is a sterling service into worse than third world offer.
That's the trouble. And, you know, you can't find most people are happy with their doctor's situation, or they're happy, or they've got a family member who's got a problem. Many people are going private, of course, which is removing a lot of names off the list, because even if they haven't got the money, they're finding the money because they just simply can't wait around anymore.
Mike, it is not just finding the money. You know, if they're not actually upgrading registrars to become senior registrars on the way to become consultants, we are going to have a dearth of consultants. So we are dumbing down the service. There'll be a loss of caliber. Already, there are many very able junior doctors in mid-rank leaving the country. So we're encountering a brain drain. That is not an acceptable situation.
Yeah.
Now, they've done exactly the same to general practice, incentivizing doctors to the extent that they forget their professional ethos and patient advocacy.
Yeah.
So I mentioned before in my previous interview with you that the professional ethos has been so distorted with financial incentives. What they forget is the health service is there, not for the politicians, not for the managers, but for the patients.
Yes. But the trouble is, the patients are made to feel very unwelcome in an awful lot of hospitals, and they're made to feel pretty unwelcome in an awful lot of GP surgeries, and they're kind of treated as if they're a bit of a nuisance. You know, and this all started during COVID, and it was kind of like, you know, we'd all be a lot better off if we didn't actually have any patients, and we just had hospitals that ran very smoothly. Nobody had to go into work, really. They could all take the day off and just sit there and collect money from the government. But unfortunately, you know, there are patients, and they do need help, and they need help quicker than they're getting it.
Absolutely right. That is what I call a tripartite compact. You know, the government taxing the people, paying the doctors, look after the patients. The whole system is collapsed. What we need to do is to put a party in that can sort the problem out properly. And I put forward this in the policy forum back in 2003, way back then, to Andrew Lansley that we need to change track. We haven't.
Yeah.
We've gone from bad to worse.
Yes. And in your view, Dr. Teck, is it because of the kind of intransigence of the system, the administrators, the managers, the people who kind of construct how the NHS works? That seems to be where the problem lies.
You're absolutely right, because the relationship between the patient and doctor needs to be brought back into the forefront.
Yeah.
We don't need the government to interfere. We need the profession to deal directly with the patients. There'll be an infinite improvement in the quality and outcomes overnight.
It would be nice to see, but I fear we may not see it in our lifetimes. You never know. Dr. Teck Khong, very good to talk to you. Very nice to see you.